Desi. I've worked with Dr. Vargo for the last 7 years. That's how long I've been at MNGI. I'm his patient care coordinator. He would stop whatever he's doing for a patient. He's extremely compassionate. Whatever he sees, whatever he does, he'll pick up the phone and call a patient immediately and give him a lot of attention. He truly has, beyond just patient care, it's real complete compassion. So he had an accident a few years ago while skiing. One of the advice for the future in regards to that was take the corners slow when you're skiing. He met a friend in Mexico when he was traveling who was teaching him Spanish, and he said, he makes me laugh so much. So my advice is spend a lot of time with your friend who makes you laugh and learn Spanish as part of your goals for retirement.
My name is Erica Jardy. I am the site director for Venice Heights. He's such a kind and caring soul, and it's been great to see his connections with his patients over these last few months when he made the decision to retire. It's been very heartfelt. It's been very hard for him to say his goodbyes to his patients. He's had a couple of moments coming in my office with some tears, but it's been very sweet. I'm glad that I've been able to be there for him in some of those situations, but it's also been nice to see that side of him. Something I have learned from him that I will carry throughout the years would be to be a patient and kind and caring, compassionate person. He absolutely exudes that every day that I see him.
I first met Dr. Paul Vargo when I was an intern, long before I was even in GI, and Dr. Vargo was my resident. We worked together at the VA in Minneapolis when we were both in our training. And I knew at that point what I learned from him told me that he was a really superb clinician. And I was so fortunate to know years later when I joined MNGI that he was already a member in St. Paul, and that we would have the opportunity to overlap our careers and work together again. My capacity in working with Dr. Vargo was sometimes limited by the fact that he worked in St. Paul and I was in Minneapolis, but we had overlap on a lot of committees. Early on in the days of adopting the electronic medical record, Dr. Vargo and I were on a committee together where we actually helped to formulate what language would be in the EMR for doctors and staff, what click buttons there would be. I mean, it was really kind of rudimentary, but we worked together that way on establishing a lot of the language that would be used in the electronic medical record. I do know that he has incredible compassion for his patients. And like many of my MNGI colleagues, his focus on patient care was exemplary. Dr. Vargo's impact here at MNGI has been very large and encompassing, not only for his colleagues, his partners, but clearly for patient care. And that'll be missed. I'm sorry to see that he's made the choice for himself to move on to the next phase in his life, but he'll be missed from many here at MNGI, including his patients. And I also wanted to say that I've learned that he has an incredibly eclectic taste in music, and so I'm sure in his retirement he'll have the opportunity to search out new venues and new performers so he can expand that part of himself.